My name is Dr. Daryl Dykes. I'm an orthopedic surgeon in Pelham, Alabama, and I'm here to discuss total knee replacement. Total knees are applied to people who have failed non-operative measures such as therapy, intra-articular steroid injections, anti-inflammatory medications, gel shots or hyaluronic acid injections, arthroscopy, weight loss being common treatments for arthritis of the knee. If these are failing and you have functionally limiting pain, pain that is keeping you from doing what you would like to do with your life, pain that's waking you up at night, and certainly if you're having giving way sensations within a knee, these are all very good reasons to consider total knee replacement. Total knees are performed to get rid of functionally limiting pain. For most people, the problem is that bones are rubbing on bones, and that causes a lot of pain. And the way a total knee works is that we do some carpentry on the knee to resurface the knee. We usually use an anterior approach, a small incision in the front of the knee. Once we go through that incision, that exposes the end of the bone. We have fancy jigs that we put onto the bone that allows us to cut the bone in precise manners. Once we remove just the very end of the bone, we replace it with a metal cap that's made out of stainless steel. The cap goes on the end of the bone and it is cemented to the bone. You do the same thing on the other side of the knee with the tibia. That's your shin bone. The shin bone, we cut the top of the tibia and replace it with a metal cap. Metal cap is cemented to the bone as well, and a plastic liner is inserted into the tibia, locked into place, and this in effect becomes your new cartilage. So once the procedure is performed, you now, instead of being bone on bone, you have metal, plastic, metal, which allows you to flex and extend the knee smoothly without pain. This plastic that is on the tibia, we also usually apply a small piece of plastic on the back side of the kneecap, and the kneecap then slides over the end of the femur in this groove, which restores motion of the knee. This procedure allows us to get you up walking on the knee almost immediately after surgery. For patients that are going home, we have you up walking approximately an hour to two after the procedure, after you wake up a bit from the anesthetic. The procedure can be done with you asleep with a general anesthetic. We also do a block in the thigh to block the nerves going down towards your knee. I'll also do an injection inside the knee with anti-inflammatory, which also helps block the pain response after the procedure, which is very helpful in trying to get you moving quicker after the procedure. You can also do the procedure with a spinal block instead of going to sleep. That sometimes is a concern for people that don't want to go to sleep or are concerned about having the anesthesia interfere with their mentation or thought process for a day or two after procedures. The current techniques allow us to get you moving rapidly, and that to me is really the key to the operation. Folks that get up walking on the total knee quickly, bend their knee rapidly, get the strength back in the leg the quickest tend to be the happiest patients. Being hesitant with the therapy tends to be a recipe for disaster, and you really want to be in a good mindset to be very aggressive with physical therapy to get moving as quickly as possible after the procedure. As I mentioned, a lot of patients, probably half of the patients nowadays, are able to go home immediately after procedure in the immediate post-operative period. Therapists come to the room, get you up, get you walking, and as long as the therapists are happy with your progress, they feel like you're safe to go home, we allow you to go home. When you go home, it is preferable to have someone at home to help you, a significant other, family member, friend, that can help you for at least the first week after the procedure. This greatly facilitates the ability for you to go home after the procedure. If you do go home, home therapy comes to the house the next day. They take care of pulling the drain, dealing with any wound issues you may have. They also facilitate therapy in the household. Once you get moving well within a few days to a week, we try to transition you to outpatient therapy. Outpatient therapy is more aggressive. They're able to put you on the bike and the weights, that sort of thing, to try to get you moving a little quicker and get you back to your life faster after the procedure. If you're unable to go home the day of the procedure, and this is usually on people that have comorbidities such as other illness, general disability secondary to prolonged immobilization, medical problems, or even people that are a little older, tend to stay in the hospital for at least one night. We have the therapy come to the room there in the hospital, get you walking the next day, and the vast majority of people are home by the end of the first day post-op. After the procedure, you'll have a waterproof bandage on your knee. This will allow showering for the first 7 days after the procedure. This is a great invention. Makes things much easier after the procedure. Essentially can start showering as soon as the drain tube is pulled from the side of your knee, which is usually the first day after the procedure. Complications from a total knee. The biggest one is infection. We make sure that you are scrubbing or washing your knee with an antibacterial soap for the day before the procedure. We also scrub the knee at the time of the procedure. We use sterile drapes, antibiotics in your vein, antibiotics in the cement. I wear a spacesuit when we do the procedure. We're essentially doing everything that's humanly possible to prevent an infection. But even doing all that, 1 in 100 is the national average for infections after a total knee replacement. Obviously, if you're that 1 in 100, it can be a very big deal, but 99% do very well without any further intervention with the implant. Other complications, when we do the procedure, there's a small incision in the front of the knee. Right underneath your kneecap, there's a small nerve that goes out, that supplies the skin on the outside of your knee. That nerve has to be cut with any incision in the front of the knee over the kneecap. All it does is produce a little bit of numbness on the side of your knee. It does not affect the function of your knee. Other complications would be wound problems in the knee. That's fairly rare. Also, there is about a 1 in 10,000 chance of dying from an anesthetic. That's an extremely rare complication, and you take on greater risks every day as you drive home from the office or from your house. The risk for being in a car accident are far greater than any anesthetic risks with the procedure. After the procedure, we usually have you come back to the office about 2 weeks after the operation to remove the staples. At that point, we assess how you're doing, making sure that you're making your goals for range of motion. Essentially, after the procedure, there are no restrictions other than do not fall. We are sticklers on trying to get the knee moving as fast as possible. And as I mentioned before, that is a recipe for a very successful knee without a great deal of delay after the procedure. If you have any questions regarding the procedure, or you feel that you may be a candidate for this type of operation, please feel free to contact us in our office in Pelham, Alabama. That's Alabama Bone and Joint. The phone number is 205-621-3778. Thank you.